Do know that this month of September, we do throw some focus on kidney health specifically. And we know that at least 1 in 10 people suffer from chronic kidney disease. And what is scary is that many do not even know that they do. This first week of September is Kidney Awareness Week, and we're going to be focusing on this morning. We're getting some do's as well as some don'ts from dietitian Zarina Ibrahim from the Association for Dietetics in South Africa. A very good morning to you, Doc. And thank you so much for your time today. Now, as far as the importance of the kidney in the body and the function of the kidney, won't you just take us through Biology 101 and just highlight that for us?
Hi, thank you. So the kidney, we all know that the kidney has a big function to play in terms of excreting waste products from the body, but it's actually a chemical factory in our bodies. So they are involved in a lot of functions more than this excreting your waste products and your fluids. So for example, you are excreting your fluid, your waste products. So it's important in balancing those. It is important in manufacturing hormones. That's involved in red blood cell production. It's involved in activating your vitamin D in your body, which is very important for your calcium absorption. So, and also for electrolyte balance, very importantly. So when your kidney no longer functions, all of these functions are actually affected. So you have a myriad of functions that the kidney performs, and the kidney is actually a fascinating organ in your body because of the multiple roles that it plays. Yes.
And what are the different factors that can lead to kidney malfunction?
Okay, so there are various causes for kidney failure, and within South Africa particularly, hypertension is the major contributor. So we have a big problem in our communities with hypertension. There's also something called glomerular diseases, and then also diabetic nephropathy. So all your chronic non-communicable diseases are causes or contributing to chronic kidney failure. And as I said, the main one is your hypertension. That's your high blood pressure.
High blood pressure. I believe obesity also is a factor.
Obesity is a major factor. And within South Africa, we've got almost half of our population being obese. So about 50% of our population, and predominantly females, about 68% of females are overweight and obese, and 31% of males are overweight and obese. And obesity is also contributes to a lot of other diseases such as diabetes, cardiovascular diseases, and hypertension. So definitely obesity is a major risk factor. We are one of the countries that has the highest prevalence of obesity in the world. So I think we're about third in the world. So it's a huge problem.
Dr. Zarina, I find this quite interesting, and the definition of obesity, there's clinical obesity, and I guess there are also cultural preferences or cultural norms. How does one find out whether or not they fall within clinical obesity, even though some people would say, no, you're looking good, you're looking awesome, ugwele or fit, whatever the case may be, but clinically, you know, the medical reports say you're obese. Tell us about that.
Okay, so obesity, you usually look at what we call the body mass index, where we take your weight and your height and we square the height and you get a figure. And usually if you are normal weight, you are between 18.5 and 25 in terms of your weight. But if you're over 25, you are considered overweight. If you are over 30, you are considered obese. And there are different categories of obesity, class 1, class 2, class 3. So technically, that is kind of the clinical definition. We also very importantly look at waist circumference, because remember, you can't only look at weight. Some people are very muscular, and so that makes their weight a bit higher. So body composition is very important to look at, looking at how much muscle you have, And, you know, but that is a little bit more technical because you have to do specific tests for that. So also within our communities, being overweight or obese is considered to be healthy, because it means you are, you know, you've got food at home, and, you know, if you're too thin, some people think you are sick. So the cultural norms also come in from that perspective. So definitely you have to look at your body mass index, and also it's not just about your weight, it's also about your other risk factors. So it's looking at your, like I said, what exercise you're doing, looking at your cholesterol levels, looking at your blood pressure levels.
I would, Dr. Zarina, just in the interest of time, want to touch on the symptoms. How do you know if your kidney is malfunctioning? What do you look out for within your body?
Okay. So kidney disease is actually a silent disease because you've got various stages of it. So from stage 1 to 5, and it's only when you really get to the end stages, say stage 4, stage 5, that you really start developing some symptoms. So one of the major symptoms is what we call uremia, and that is a collection of your urea and creatinine. It's your waste products basically building up. So you feel very nauseous, you're vomiting, you're throwing up, you're feeling tired. Also because your kidney is involved in red blood cell production, you also feel very exhausted because you're getting anemia. You may have cramps and itchiness because your phosphate levels are high. So there are definitely warning signs, and you also lose weight because it's quite a catabolic disease while you get to the end stages. So like I mentioned, you may not know at stage 1, 2, 3 that you've actually got kidney disease. So therefore, it's very important that you actually check your levels and you go to the doctor regularly to have yourself assessed.
So when you're checking, what exactly are you checking for? What levels?
Okay, so you have to check your blood pressure because, as I said, that is one of the major contributors. You have to check, so they would do a blood test and they would check your urea and your creatinine. Those are your kidney function tests, and then also your glomerular filtration rate. This is also a kidney function test. It just shows you where you are in terms of normal kidney function or whether you're going into one of those stages, as I mentioned, stage 1 to 5. So usually also with hypertension and with diabetes specifically, if you've had those diseases for many years, you're going to have some stage of kidney disease. So that's why when you go to your doctor and you go for your checkups, you go to the clinic, ask your doctor what your numbers are. You want to know, what is my cholesterol, what is my blood pressure, because that's very important.
So Dr. Zarina,
and your kidney function, yes.
As we wrap up this morning, yes, perhaps you are diagnosed with renal failure. You've got two options. One of them is dialysis, which one can take. But there's also the kidney transplant. Talk to us very briefly through that process and what exactly is a donor match as far as kidneys are concerned.
Okay, so with chronic kidney disease, there are various types of treatments. So there is the conservative treatment where you don't get any type of you just get basically your medication and your diet, and this is very important to manage your chronic kidney disease. Then you get what we call dialysis. Okay, so dialysis, you get hemodialysis and you get peritoneal dialysis, and this is basically meant to take on the role of your kidney in your body because you no longer have kidney function left. And then you get the transplant. So the transplant is basically replacing your kidney, although it doesn't mean that you can live obviously a healthy, normal life, but there are immunosuppressants that are given to you so that your body, because remember it's a foreign organ that's coming into your body, so it's not your own organ. So you can reject that kidney, and therefore they give you immunosuppressants. And these immunosuppressants also have side effects. And usually they do try to match you according to, they look at your family and they look at whether there's a match there, or otherwise you'll have to go onto the waiting list where a donor becomes available. And then they also look at tissue matching and blood just to see if you are a match for the kidney. There is a dire shortage of kidneys, so the best advice is to try and prevent kidney disease as much as possible. Also within South Africa, we have a very high prevalence, and we know that most of our population is in the public sector. About 85% gets public sector care. And in the public sector, not everybody can get dialysis or a blood or a transplant, because there is a strict criteria for patients to get onto the program. So there are very high chances that if you do get kidney disease and you need dialysis or a transplant, that you may not be accepted, especially if you're diabetic, that you may not get accepted onto the program.
Dr. Zarina Ibrahim, thank you so much, so much insight. And I mean, as you said earlier on, it is one of those diseases that can be prevented, and diet actually plays such a huge part of that, so making sure